Hello and welcome. Today we are diving into a question that is on so many minds. How do you actually know if fertilization has happened? We're going to look at the very first, really subtle signals your body sends out, way before a missed period or a pregnancy test can give you that clear answer.
You know that feeling, right? That 2-week wait where you're analyzing every single little twinge, every mood swing, and just wondering, is this it? Is this the month? Well, if that's you, you are in exactly the right place. We're going to break it all down.
Okay, so first things first. To understand any of the early signs, you've got to start with the timing of your own cycle. It's all about knowing when conception is even on the table. So let's just take a quick look at a typical 28 to 32 day cycle. See that highlighted section? That's your fertile window, usually somewhere between day 10 and day 20. This is the time frame where everything needs to happen. It's the moment you really want to be paying attention to. And what's the star of the show during this window? It's ovulation, of course. That's when the egg is released, making the whole thing possible. So for conception to happen, you want to be aiming for the few days leading up to ovulation and the day of ovulation itself. So let's imagine the timing was perfect. The egg and sperm have met. What happens next? Well, the first huge milestone is something called implantation. This is the true physical beginning of a pregnancy. Implantation is where the journey really truly begins. That tiny little fertilized egg travels down to the uterus and kind of snuggles in, burrowing into the uterine wall. And that event is the trigger for all the hormonal changes that cause every single one of the early symptoms. Okay, so what's the timeline on this? Well, implantation usually happens about 6 to 8 days after ovulation. So it's during this time, just a little over a week after you've likely ovulated, that you might start to notice the very first little physical clues. And this is where it gets really fascinating. As soon as that implantation is successful, your body starts communicating, but in a totally new way. It's sending out these subtle, almost secret signals. The big question is, are you tuned in enough to notice them? All right, let's play detective and start decoding those signals. We're going to look at the very first physical changes that happen as a direct result of that successful implantation we just talked about. One of the absolute first signs many women feel is a very specific type of cramping. Now, I'm not talking about your normal, full-blown period pain. This is something much, much more subtle, happening deep in your lower abdomen. So what makes it different? Well, it might feel like a little pull or a stretching sensation. Some people even describe it as a flutter, almost like butterflies. It could be on the left, the right, or right in the middle. But the main thing is, it's way lighter than typical menstrual cramps. Now, right along with that cramping, you might notice something else that can be super confusing, a little bit of spotting. This is what's known as implantation bleeding. So how in the world do you tell the difference? Well, implantation spotting is usually super light, like just a few spots, and the color is often a light pink or even brownish, not that bright red you see with a period. And the biggest clue? The timing. It usually happens about 5 or 6 days before your period is even due. Okay, so once implantation is done and dusted, your body hits the go button on pregnancy hormones, especially progesterone. It starts pumping it out like crazy, and that kicks off a whole new wave of symptoms. And trust me, these hormones are powerful. They cause all sorts of changes all over your body. We're talking about a rise in your body temperature, feeling way more emotional, changes in your breasts, maybe some nausea, and yeah, running to the bathroom a lot more. Let's break these down one by one. So that big surge in progesterone can actually raise your core body temperature just a little bit. It's not a real fever, but you might feel consistently warmer than you normally do, almost like you're on the edge of getting sick, a little toasty. Now this is a classic, and for a good reason. Your hormones get to work on your breasts almost right away. They can feel tender, really heavy, or full. You might also notice your nipples look a bit darker or wider, and those little bumps around them might become more obvious. And the hormone party doesn't stop there. You might find yourself crying during a happy commercial or laughing hysterically for no reason. Hello, mood swings. That queasy feeling, especially when you wake up or brush your teeth, classic nausea. And that constant need to pee, that's because all the extra blood flow is making your kidneys work overtime. So you've been noticing some of these signs, you're ticking some boxes. What's the next step? While all these feelings are fantastic clues, the only way to know for sure is to test. Let's talk about how to get that final, definite answer. For the best, most accurate results with a home test, I know it's hard, but patience really is key. The best time to test is after you've officially missed your period. Waiting about 4 to 6 days after that gives the pregnancy hormone enough time to build up in your system. And if you see 2 lines, well, you've got your answer. But I get it, waiting can feel like torture. If you absolutely cannot wait, a blood test from your doctor is way more sensitive. It can often detect a pregnancy a day or even 2 before you miss your period, giving you the earliest possible confirmation.
Before we wrap this up, there is one last thing that is incredibly important to talk about. During this super sensitive time, what you don't do is just as important as what you do.
And please listen to this one carefully. If you think there is even a chance you might be pregnant, do not take any medicine, not even over-the-counter stuff like painkillers, without talking to a doctor first. Some medications can actually interfere with that delicate implantation process. It is always better to be safe and get professional advice. You see, in the end, the earliest days of pregnancy are really all about this quiet, subtle conversation happening between you and your body. The signals are there, from that tiny little flutter to a sudden change in your mood. The journey really begins with just learning how to listen. Thanks for tuning in.